At the outset, I would like to thank the organizers as well as Dr. Ghansham sir and Dr. Manisha ma'am for giving me this very kind opportunity. It is my real pleasure and honor to present in today's forum. And my talk is about innovations in footwear technology to prevent diabetic foot ulcers. So I'll cover this talk in two parts. First, I will talk about the footwear per se, and then in the second half, I will talk about some technology gadgets that we can use to improve or to prevent diabetic foot ulcers. So to begin with a slightly philosophical note as well as a scientific note, footwear in diabetes can be a giver. It can give rise to foot lesions as well as ulcers because of if it is ill-fitting, inappropriate footwear. But at the same time, it can also be a taker. So it can take away the load from the diabetic foot, redistribute the load, and thus prevent diabetic foot ulcer. So our aim is to give footwear which will take away the load and prevent ulcers. Now, if you look at the current guidelines from IWGDF, they have categorized the risk from low to high risk patients and given some footwear recommendations. For example, footwear which accommodates the shape of foot. And for the very high risk patients, we need custom made footwear which can reduce the plantar pressures. But I want to highlight the level of evidence. It is just low to moderate. So there are several studies which have looked at this footwear, but there is no 100% conclusive data. Some studies have shown favorable results, some have not shown favorable results. Now, this is the most commonly used footwear in our patients in India, which is a typical sandal made up of MCR insole, and it is very useful. It has saved many feet, I would like to say. But there is one study which said that the patient acceptability of this footwear is low. It is because of the same typical design and same color. And this is really true. If we go to a function as a doctor, we can just identify by looking at their footwear who is having diabetic foot or diabetic foot ulcer. So just this is so typical footwear. So some things need to change in this footwear. So there was a study which looked at all the different seven types of rubber materials available and at their as a therapeutic insole material. And what they looked at was the deformation capacity of the material. And if you look at EVA, EVA is ethylene vinyl acetate, and it has the lowest deformability on the left hand side, and highest is for MCR rubber. If you look at the stress levels, then that is also low for EVA, whereas it is highest for MCR insoles. So what it tells that probably because of the lower deformation and the lower stress values, EVA is probably a better insole material for patients with diabetic foot. But on the other hand, if we take the property of increased deformability of MCR, it helps to redistribute the plantar pressure. And that is why, because of increased deformability, it is advised that patients should keep changing their footwear frequently so that because with time, within few months, the MCR insole will get worn out and we should change it. That is the advice that is given to patients which they don't follow. So how can we put both of these together so that it gives the best product for the patient? So the best way forward is to use technology by using multiple layer footwear. So outer sole made of something which is very firm, that is EVA, a midsole which is made up of MCR insole, and a soft lining of polyurethane. This is the ideal footwear. It will be available in certain markets, but still somehow we use the previously available MCR insole. So if we search or if we are having a facility which makes footwear, then we should try to inculcate this three-layer footwear for most of our patients. Now, second study I wish to highlight is a computer-assisted customized footwear versus the traditional MCR footwear. So in the intervention group, they took a foot scan, then they designed the insole with the help of CAD technology, which is computer-assisted designing, and then computer-assisted manufacturing with 3D printing. So they printed and took the insoles, and they looked at the ulcer recurrence at a new site as well as the same site. We can see the dramatic difference. In the intervention group, it was dramatically less. The rate of ulceration recurrence was dramatically less as well compared to control. So if we use technology in designing as well as manufacturing the insole, then it can dramatically reduce the or prevent ulcer recurrence in diabetic patients. Now, apart from all these properties of footwear, what else can add to the footwear? So what studies have shown is adding an arch profile. So what it says that if we look at patients' studies or meta-analysis where arch profile was given, where there was no arch profile, then those who had an arch profile, the addition reduced the peak pressure by a mean of 37 kilopascals. So if we put all the things together, then a three-layered footwear which is designed with the help of CAD/CAM technology, and then add to that a arch profile. So commercially arch profile footwears are available, so we should try and find out such footwear for most of our patients. Going to the second part of my talk, it is about certain factors which will help to reduce ulcer recurrence by using technological gadgets. So the best way is, the first step would be to monitor. So we need to monitor the plantar pressure of the foot. We can look at the skin temperature. We can use certain anti-infective measures. So now there are antifungal and antimicrobial insoles which are coated with silver oxide, for example, and which can probably prevent infection. So in a very practical setting, most of our Indian patients who have either a poor footwear hygiene, or if they have autonomic neuropathy with lot of fissures and cracks, then they are at a high risk of, that is a portal of entry for infection. So if we use such kind of anti-infective insoles, then probably that may help in reducing the incidence of diabetic foot infection. And then lastly, looking at adherence in all these patients. So this is an example of a basic smart sole. We can see there are three sensors here, which are there in the forefoot and the hind foot. And then there is this graph is seen on the patient's smartphone. It tells the pressure while the patient is sitting, standing, walking, or recumbent position. And once he sees the patient that his pressures are rising, the patient can take a action by offloading. That is, he will stop walking and sit for a while so that the pressures are reduced. And that is the way we can use technology to reduce plantar pressures. Now, better version of this insole was done in this Lancet study where they had two groups, intervention and control group. Both the patients, both the groups got the same insole, that is the innovative intelligent insole system. And you can see it here. It looks quite sleek, this black one, and it had several pressure points that were measured in this insole. In the intervention group, they also got a feedback through a smartwatch, whereas in the control group, they used this insole, but they did not get feedback. And this is how the mobile or smartwatch showed that this red area is area of high load. Then the patient was advised to stop walking, sit for a while. Then the smartwatch will give the feedback that now your load has come down and now you can again go back and walk. So this will help to reduce the number of steps that the patient is taking, help in improving adherence to offloading. And the results were also quite promising. At the end of 18 months, the ulcer recurrence was reduced by almost 70% in those patients who were getting the feedback versus those patients who were not getting the feedback. So definitely technology can help in prevention of ulcer recurrence. Now, the second aspect which can help us predict that why an ulcer occurs is measuring the skin temperature of the plantar aspect of foot. It can almost by 87%, it can help in reducing foot lesions. And it has been shown that at least 1 or 2 weeks prior to development an ulcer, this rise in temperature can help us predict that the patient is going to develop a ulcer. So this is one way which studies have used. This is a special infrared camera which will take thermal prints like this one at high pressure areas. So if we ask our patients to come on a regular interval to OPD, take such infrared pictures and show them that your temperatures are rising, give them footwear, give them advice regarding offloading, then definitely we can help prevent ulcers. But this can be somewhat cumbersome. But what this study showed that the lateral three bars represent the patients who are having complications of neuropathy, ischemia, and neuroischemic foot. In all this group of patients, the temperatures were increased as compared to those who were healthy or healthy diabetic patients. So regular temperature monitoring can be helpful. Now, this may sound a bit cumbersome that the doctor has to buy a camera, patients have to uh, spend money, come frequently. So the next option, which is not available in India but abroad, These are smart socks which can measure the food temperature. There is a small transmitter on the upper side, you can see, and it gives feedback to the doctor, patient, and their diabetic nurse. So once the temperatures start rising, then the nurse will call the patient, examine the food, whether there are any high pressure areas, and if there is any pre-ulcerative lesion, that will be tackled. So in this way, we can use technology to reduce the prevalence of ulcers. Now, do you really think all these measures can make a difference? Definitely, they can make a difference. But what exactly makes a difference? Just last 30 seconds, sir. So this study, it looked at two group of patients. Both the patients got custom-made footwear, but in group one, the footwear was designed with the help of measuring plantar pressures. Now, what is the expected outcome? It should show reduction in ulcer in group 1 because they got additional knowledge of that the plantar pressures were measured and footwear was designed. But it was very unexpected. In both the groups, despite having a custom made proper plantar pressure ulcer footwear measurements were done, the ulcer recurrence was same. But if you look at a subgroup analysis where the adherence was very high in those patients, then in the intervention group, the chances of ulcer recurrence had dramatically gone down. So what I want to make a point is that the most important factor is adherence. If our patients adhere, then they get better results. If they don't adhere, they don't. So we also know in our patients that we prescribe them a footwear, they buy it, but they don't use it inside the house. They stay for a long period of time, but they never use inside house. They will never use it for any functions. They will just use for somewhat walking, and when they come and visit us in our clinic to show it to us that we are wearing it. So that is what is lack of adherence in our Indian patients. So technology again can help solve this problem. So such kind of smart watch which can show you all the information, how many steps were taken today, the boot is on, the boot is off. There is a smiley that you are doing great. You have been wearing for several hours now. You have removed it. So all this information will be given to the patient and the patient will do better. So to sum up, this is the workflow that we can do. First is to, on the top, you can see, identify a very high risk patient who is likely to develop ulcer. Then do monitoring with help of plantar pressures, skin temperature, smart socks whenever they are available. Then use technology like CAD CAM to design a proper footwear and insole. Use the multi-layer footwear, add a arch profile to it, and then give them a smartwatch or a smart app to ensure adherence. So that is how the full circle will be complete and help to reduce the incidence of diabetic foot ulcer. Thank you.